Well, with the sixth wave here, let's check in with infectious disease specialist Dr. Zain Chagla this morning. Good to see you.
Hi, good morning.
Good morning. So here we are in the sixth wave. The latest wastewater sampling is showing we may have plateaued, but still Dr. Kieran Moore, Ontario's top doctor, is recommending that we keep the masks on beyond April 27th. School boards are asking for the same. What's your thoughts? What do we need?
Yeah, I mean, I think people should still consider a mask in high-risk settings, crowded settings. Just because we peak means there's still a lot of disease in the community, and again, using personal protections, especially for vulnerable people, is important. I think again we can still leave things at not necessarily making it an enforceable behavior, but still a very recommended behavior by public health, which is amongst the other recommended behaviors by public health we have on a day-to-day basis.
We've been so focused on COVID-19 vaccinations. Are others falling behind? Is there a new concern with measles?
Yeah, absolutely. In Europe, measles vaccine rates have fallen down. There was already measles circulating in Europe at the time. There's global concerns around childhood vaccinations and many of those programs being lost. There's polio outbreaks now ongoing in Israel. There is some of this that has been lost. And I think we have to be very careful, especially, with how we approach decision-making around vaccinations, like COVID vaccine in parents, recognizing that there is a number of vaccines that children need. And again, we have to make sure they're accessible, that education is proper, and a lot of the anti-vaccine rhetoric that's going around doesn't get lumped into those other vaccines, which are just as important for childhood development.
Right. Back to COVID. So Health Canada has approved something from AstraZeneca, Evusheld. So this is for the immunocompromised population, and it's, what is that, a preventative tool?
Yeah, absolutely. So, when you get vaccinated, your body triggers a lot of different machinery to make antibodies, T cells, B cells, lots of different things to help with protecting yourself against COVID. This product is essentially antibodies. These are antibodies that are pre-formulated, that are very long acting, that act months in the system. They're not a replacement for vaccine, because vaccine will do a whole lot more to generate more antibodies. But for people we know, like organ transplants, people on certain medications, people getting chemotherapy, vaccines with an impaired immune system don't work very well. And so this is a guarantee that people get those antibodies to help protect them. It's not as good as a vaccine. Again, the machinery to make antibodies is a whole lot more powerful than antibodies themselves. But it gives another layer of protection to those populations that really may not get as much benefit from vaccine as the general population.
Now, the Ontario government began distributing Paxlovid to select pharmacies, and of course your team at the St. Joe's has seen incredible success working with antivirals and using Paxlovid. So what does it do, and who's eligible for this?
So right now, the Ontario guidelines say anyone over the age of 70, anyone under the age of 70, either 60 and above or between 18 to 59 with one medical condition and that's had less than 3 doses of vaccines are eligible. They have to have a positive test and be symptomatic and be within 5 days of that. Again, we've given a lot of this. We've had great success. It does require a little bit of work in monitoring, especially with drug interactions. But it's great news that people can get it from their primary care providers, from their specialists, at the level of their pharmacies, recognizing that, unfortunately, a model like ours, which has been great for the community, is probably not going to be able to sustain and reach everyone in that sense. So people can get it in their small communities, their large communities, and urban and rural centers. And so again, if you're eligible, contact your healthcare provider and start that process, because it can be filled at something as simple as a Shoppers Drug Mart for someone to protect themselves against the severe complications of COVID.
And really help keep this under control. Well, thanks for joining us. That's our time. We'll talk again next week. Dr. Zain Chagla, infectious disease specialist.